Questions?
Governor, the Biden administration has announced it's starting direct shipments of vaccines to retail pharmacies next week. What does that mean for Massachusetts? And separately, is there an update on the amount of doses we are getting week to week?
So I mentioned in my remarks that there were 30 pharmacies that would be opening next week. That is driven in part by the Biden administration's decision to move more vaccine directly to pharmacies as part of their distribution plan. And we are still working on what I would describe as sort of the 1 week window into visibility. And we certainly don't expect, I mean, the commitment's basically been you're not going to get less. But at this point in time, they're still working out what they think a ramp would look like going forward. And we're basically planning for an assumption that, you know, what we've got in the last few weeks will probably be pretty consistent with what we get over the next few.
So still about 100,000?
Yeah.
And
New doses, yeah.
New doses. And just to clarify, the 30 pharmacies, how does that work? Can people just call them and set up an appointment? How does that work?
You can either call them or you can go to their websites or you can go through the MassVac site to those pharmacy locations and book an appointment. And they all in represent roughly 15,000, what we think of as 15,000 incremental new appointments that will be available starting next week.
And only people involved in this current phase can do that right now?
Yeah.
Governor, we're hearing from a lot of senior citizens who cannot make it to Fenway, they cannot make it to Gillette, they live on the Cape. Any plans, or I know you said 2 more mass sites are coming. Can you tell us where those are going to be and when you could announce them? Even regionally?
So first of all, there's a lot of conversation going on between our administration, healthcare providers down on the Cape, and others to expand access to vaccine sites on the Cape. Same thing's going on in other parts of Massachusetts as well, but I'm not going to, I mean, I can't speak to who the players might be and how this is going to work until some of these discussions have been finalized. But there are conversations going on with the most important players in those areas to figure out how to continue to expand capacity.
Are we waiting for more doses so that you can stand them up? Because you had mentioned you don't want to open up all these places and then have no vaccine.
Well, that would be a big concern, yeah. And as I said, we're still, the administration knows, the Biden administration has heard from, I think, every governor in the country that we would really like to see 2 or 3 weeks worth of visibility into the supply chain. And they have said to us that that is something they are going to seek to do. But at this point in time, we're still playing the 1 week game.
Governor, can you give us an update on the administrating rate? The CDC has it like 60%. I remember you said it was like 50. I know we still have this lag. And why can't we get those vaccine numbers on daily? I know Mary Lou Suthers is pulling her hair out, but...
Well, I think I said as of, what did I say in my remarks? As of yesterday. I do it from memory, but I get it wrong. As of yesterday, drum roll, no. It's going to be on the last page I look at. As of Monday night, okay, 654,004 doses, 104 doses out of just over 1 million that have been shipped to providers in Massachusetts. So that's about 60% plus, a little bit more.
And has that changed that you guys talked about the last week with the 10-day deadline to redistribute if people aren't using them? Is that helping at all?
Well, you do have provider organizations that had originally received doses to vaccinate employees who are now taking those doses and calling patients in their panels who qualify and having those folks come in to get vaccinated. That started this week. In addition to that, some of the growth in the pharmacy volume will be coming out of an oversupply on the long-term care and the SNF program. One of our big issues here in Massachusetts was they sent way more vaccine booked to Massachusetts to the long-term care piece than we're actually, I don't know if you can hear me, but I'm getting a lot of background noise. arms available to vaccinate. And so part of the reason why we're going to see a significant increase in the number of pharmacies that are doing retail next week is because some of what was originally supposed to be part of the pharmacy program for long-term care is now going into the community. Both of those things should make a difference with respect to the relationship between shipped and administered.
When can cities and towns expect getting direct shipments to either councils on aging, fire departments, whatever? I know the fire chief in my town has a list of people who's going to get it, but he doesn't have a vaccine.
So it depends a little bit on the nature of the community. You got to do a certain, at this point in time, you have to be willing and able to do a certain number of vaccinations. You have to have a universe of potential people to be vaccinated that reaches a certain threshold, and you have to have the ability to store and manage two very complex vaccines currently. One of the nice things about the J&J vaccine, if it gets approved, is it doesn't have some of the issues with respect to storage that we have with both the Pfizer and the Moderna vaccine. And I also believe that as we get into what I would describe as the general public, we will be a lot more interested in distributing this far more broadly, because at that point in time, we won't have some of the rules associated. If the J&J thing gets approved, we have a much easier vaccine to administer and manage and support in settings that don't have access to deep freeze. The second is we'll then have a much bigger universe of people that will be looking to vaccinate, which will make it easier for us to think about how to incorporate additional support at the local level into this. But we already have, in many parts of Massachusetts, local boards of health and local communities that have banded together to create the vaccine infrastructure that's necessary to participate at this point in time.
Governor, there have been some concerning statistics coming out of the CDC that only 5% of the people who receive vaccine are black, and that 60% are white. The Reggie Lewis Center, we're seeing a long line of white people waiting to get vaccine at the Reggie Lewis Center. I know you said you were going to hold some doses back for people of color. Are those doses at the Reggie Lewis Center supposed to be going to people of color? And what can we do to increase people accepting it?
So one of the big things I think everybody's learned from the conversations about who wants a vaccine and who's waiting is for many people of color, it's important that the provider be somebody they consider to be a trusted part of their community. And that's one of the reasons why there are 50 CHCs, community health centers, which are in many cases trusted parts of their community, who've been a big part of how we've thought about this rollout from the beginning. In addition to that, the City of Boston, which is currently sort of co-running the Reggie Lewis Center with us, at some point they're gonna sort of have us do it fully, is setting up specific days for people from the neighborhood. And they and some of the folks from CIC Health, which is going to be administering that, have been talking to many of the trusted players in those communities about what they and we can do together to try to encourage people to take advantage of those days that will be specifically designated for people in those communities. And if you look at where most of the CVS expansion and the Walgreens expansion is going to happen, again, an entity that a lot of people go to for, pick up their prescriptions and that type of thing, especially when you're talking about older people, those folks are also going to be operating, coming out of the gate, for the most part, in communities that have been disproportionately affected by COVID. And we've also made pretty clear to a lot of the folks on the provider community who, when they got done vaccinating their employees, we said to them, we'd like you to start vaccinating your patient panels, but we would like you to do that in places where you and we all agree we've had significant issues with communities that have been disproportionately affected in the first place, and that's where most of them are focusing their efforts. And I think that trend will build over time, and hopefully we'll be able to use those trusted community partners to get folks in and to enhance and improve our vaccination numbers there.
So the doses that are being held back, how does that work?
What do you mean?
A certain number of doses, I think Mary Lou Sutter says that are being reserved for people of color. How does that?
I think of it as more as a designation than a holdback. I mean, I think there are 37,000 doses with community health centers right now. Is that about right? basically, it's more an issue about placing them in places with providers that you believe can, in fact, bring folks into their organizations and get them vaccinated.
Very good, 37,000.
37,000, okay.
Governor,
Governor.
when you ran twice, you ran as a manager of state government. That's what you bring, one of the main, strengths you bring as governor. Given the varied criticisms of the rollout and sort of the issues with it, I mean, how much do you wear that yourself, or you think that is a reflection on that reputation that you built as, I can be the manager of the state?
So I guess the first thing I would say is that I get how unhappy many people are with the rollout, okay? I hear it, the Lieutenant Governor hears it, Secretary Sutters hears it. There are some reasons for that unhappiness that have to do with the decisions we made out of the gate, which I do not apologize for. The decision we made to vaccinate straight out of the gate hospital workers and other healthcare workers, especially those who are frontline to COVID, the decision we made to organize and structure a very significant and complicated outreach program to congregate care providers who serve people with mental health issues and developmental disability issues and other special needs, and the decision we made to choose to be focused early on some of the populations that would not necessarily, homeless people, who would not necessarily be part of the rollout in many other places. I think we did the right thing there. But I get the fact that that meant other people needed to wait. And I'm not satisfied with where we are. I know the Lieutenant Governor and Secretary Sutters aren't either. But one of the things we tried to do as an administration, and I think have done well, is to be open to criticism and to take criticism and to make adjustments and to get better. I mean, I remember everybody in March all over us about the quality and the capacity we had to test. And most people, including people in this room, didn't believe we would ever get to the numbers that we talked about as we went through that process of expanding and rolling out our testing program. It's now the second biggest per capita testing program in the country. And it's turned out to be a tremendous asset in terms of our ability to identify cases, to trace cases, and to help people stay healthy and not to pass the vaccine on to others. So, look, I'm not happy with where we are. I know a lot of other people aren't either. We have work to do, and we know that. And one of the best things a good manager does is recognizes and understands that they have a problem and then busts their butt to figure out how to fix it.
Has the sign-up process been a problem, the website, the way to navigate to get that appointment? Has that been a problem?
Well, keep in mind, we have 650,000 people who've gotten vaccinated. We just added 100,000 new appointments this week. We're going to add more next week and the week after and the week after. They're getting filled, and most of them are getting filled through the website. We did a bunch of things to make the website easier to use and more geographically appropriate for people, and we'll continue to do things to improve the performance of the website. Part of the challenge with the website is figuring out how to make it work with a whole bunch of entities that are not necessarily what I think of as part of our world. The pharmacies, the Stop and Shops, a lot of the retail organizations have their own setup, and they're organized to serve, quote unquote, their customers, which makes it a little complicated for us to make it as smooth a transaction as we would like it to be. But we're continuing to update that and to improve it, and I do think the launch of the call center, especially for people who aren't familiar with how to use websites in the first place, will make a big difference with respect to accessing appointments.
When will that be up and running, though, a functioning call center?
This week.
This week?
Governor,
Congressman Presley has called the unequal distribution of vaccine distributing in color vaccine redlining. How do you respond to that?
Well, I think I answered that question when I answered Jonathan's question. Pardon me?
I just wanted to put her specific vaccine redlining words directly.
I think the most important thing we need to do is recognize that trusted community, people, organizations, institutions is a big part of how you make this happen. And the fact that we've got 50 community health centers that are currently vaccinating people, and that we've got many other local organizations across the Commonwealth who have standing and reputations in many of the most hard-hit communities, and the fact that when we had a chance to figure out how to expand our pharmacy program, we focused primarily, again, on communities that have been hardest hit here, is a big part of how we solve the issue and the problem associated with the fact that we don't have as many people of color getting vaccinated as we would like.
Governor, should senior stay up late at night? There's a lot of hotels that are staying up late at night, like they're trying to get concert tickets. Should they do that? I know you're saying that everyone's going to get vaccinated, but the call center seems like it would help them feel a bit more assured.
I think the call center will make a big difference, but I also think that people should you know, if they go on the site and there's a site that's nearby them and there's open appointment opportunities, they should take them.
Was there ever any consideration to bringing in the National Guard? Some other states have had success with that, certainly with different populations like West Virginia, for instance. Is that something you ever considered or would consider as we approach more general public?
Well, first of all, we have some planning to do with respect to how we want to get to 1 million vaccinations a month, which is where we want to be eventually this spring. And maybe they might have a role to play there. But the way we've been using the Guard currently is they're a major player in a lot of the work we've been doing to keep our nursing homes safe. And they've done a very good job on that one. And we've had dramatic improvement in infection rates, hospitalizations, and the tragedies of death associated with nursing homes over the course of the past 5 or 6 months, even as significant increases in community transmission have taken place. They've played a really important role in helping us make sure that we keep folks who are in long-term care facilities safe.
But in terms
Thanks,
of getting
everybody.
people, getting this vaccine in people's arms, you don't envision using them for that?
I think on the front end of my answer, what I said was, as we get to the point where we're talking about trying to vaccinate as many as 1 million people a month, if the vaccine is available to do that, we would certainly consider a role for them. But if we can get this stuff done without them, we'll do it that way. I'm not wedded to it. I don't start with an assumption that that's where I go first. I start with an assumption that what is it we think we can do to get where we need to go. And then if we need to incorporate them, the best part about the National Guard is they come when you call.
Governor, I'd like to go off topic. I'm waiting until now because we continue to get inundated with messages from people complaining about unemployment assistance. And now we're hearing from people who are actually getting bills from the Department of Unemployment Assistance saying that they owe thousands of dollars in overpayments that they weren't aware of. They're not in any position to pay this. They've been unemployed. Would you consider waiving these fees, these debts in cases where people are not at fault, like other states are talking about?
So I can't speak to any specific cases. What I would say is the rules of the game associated with the way the unemployment system works are made by the federal government. And we operate our unemployment program based on the rules established by the federal government. I don't know, as I stand here, whether or not any of the cases that you're talking about would involve circumstances or situations where waivers would be appropriate. I can tell you this, we are very aggressive about making sure that we do everything we can to give people the benefits that they're entitled to. And in many cases, there's a ton of casework that people do to make sure that that happens. That sits against the challenges that we all have in every state when it comes to unemployment with respect to the fraudulent activity that's taken place, which is not a secret at this point. It's gone on in pretty much every state in the country. And we have to factor that into the way we make decisions. But But we will do everything we can within the rules of the program to support people in any way we can. But the program does have rules. Those rules are enforced by the feds, and the feds do audit the program, and it made very clear to states ever since the start of this, because it's really significant money that the federal government's put into this, that states will be held accountable for complying with the program.
Governor
Thanks,
Baker,
everybody.
I think we all know that the Patriots are not in the Super Bowl, but there's a certain quarterback that's playing that might be offensive to people. Are you concerned about Super Bowl parties, super spreader events? Are you going to have any words of warning about that, and are you rooting for Tom Brady?
Well, on the last part of your question about Tom Brady, my view on this one's really simple, okay? The guy gave the people of this region a chance to go to the Super Bowl for 20 years. And 9 times out of that 20 years, he did it, along with a heck of a lot of other people. As a sports fan, I'm incredibly grateful that I had a chance to live in this 20-year period, because I've lived in other 20-year periods around here where things didn't quite work that way. And so I am rooting for Tom Brady to win, okay? I don't see how anybody around here could possibly root for him to lose, because we got so much from him. You know, I'm kind of the Grinch when it comes to almost any private event of any kind, and I get a lot of interesting incoming on that. You know, the guy who stole Thanksgiving, the guy who stole Christmas, the guy who stole New Year's, the guy who stole every holiday you can think of, made everybody build, you know, chutes for candy for Halloween. I actually built one myself. I thought it was pretty cool. But I would say the same thing I said before, which is, you know, long periods of time indoors in close quarters with shared food with people who aren't of your immediate household is just risky behavior. And I know no one wants to hear that, and I get the fact that people are tired of that sort of thing. But, you know, my ask would be, I hope people watch the game, I hope they enjoy it, I hope Tampa Bay wins, but I hope people spend it in as safe a manner as they possibly can. We've seen tremendous improvement in our case counts over the course of the past 2 or 3 weeks. We've seen big reductions in hospitalizations and ICU visits. Those hospitalizations and ICU trips are sometimes associated with tragedy, right? They are sometimes the precursor to somebody passing away who is loved by somebody else and some group of somebody else's. I can't tell you how important it is for people to recognize and understand that the virus is still very much with us. The feds continue to talk about some of the new variants, which make them very nervous. And I really think if you're going to watch the game, and I hope everybody has a chance to do that, you really ought to do it with the people you spend most of your days with. If you're going to be with anybody else, you know, I know this sounds a little ridiculous, but you should probably try to keep your distance. You should probably wear a mask, and you certainly shouldn't share food or drink with those folks, because that's just asking for trouble.
Governor, we are getting a lot of calls right now. I don't know if you know about this. The Leonardo DiCaprio movie that is shooting is causing massive traffic backups on the Mass Pike right now. Are you, I mean, it's a lighter question, but I'm going to ask you about it. Give me your thoughts on it. I don't know if you know anything about that.
I don't know anything about that. I didn't even know Leonardo DiCaprio was shooting a movie here. Generally speaking, there are a lot of rules associated with people's ability to use any roadway. So I'm actually kind of surprised to hear this, but I'll obviously check in with the folks at DOT and with the state police to find out what the story is.
Thanks, everybody. We gotta
Thank
get
you.
going.
Thanks again to Fenway and to the CIC.